Hi, I'm Dr. James Kennedy, Texas Foot and Ankle Centers. One of the big problems that I have with patients in my office is what we call plantar fasciitis. I treat plantar fasciitis all the time. I would probably say at least, I'd probably see anywhere from 15 to 25 patients a day, and I would probably say about 4 or 5 of those patients have plantar heel pain. Now here at East Texas Foot and Ankle Centers, we have a long slew of things that we do for plantar fasciitis, anywhere from strapping to taping to stretching exercises to laser therapy to shockwave therapy to cortisone injections, night splints, cam boots, Una boots, cast, pretty much every anti-inflammatory you can imagine. But one of the things that I treat is plantar fasciitis, and today we're going to go over plantar fascia strappings. Now I do plantar fascia strappings in 2 ways. I do it either with taping, like the 3M tape that you see for athletic taping, or I do moleskin plantar fascia strips that I actually place on a person's foot. So before we talk about that, before we do it, I want to show you this foot model. I like this foot model, and I show this to my patients because it shows the plantar fascia. So if you're looking at the plantar fascia on the bottom of your foot, this long gray band all the way from these metatarsal heads, 1, 2, 3, 4, 5, that connects all the way down to this bone called the calcaneus, is actually attached by the plantar fascia. Okay, and it's divided into 3 bands: the middle band or the medial band, the central band or the outer band, or the lateral band. Okay, so plantar means bottom of the foot, dorsum means top of the foot. So if you have plantar fasciitis, plantar means bottom and fasciitis means inflammation, like arthritis in joints. So one of the things I do starting out, I start out doing plantar fascia straps. So there's different types of plantar fascia straps on the market, but this is a small demo model that I have. Actually, this is a large one. This is a demo model, and I put it on the bottom of the feet. It has an adhesive tape, and there's typically 2 types that I put on besides the white athletic tape. But what I'm going to do today, I'm going to demonstrate what a plantar fascia strip looks like and how a person needs to protect it during the week. Again, just for more information, if you're looking at different foot models, this is an arthritic type foot with plantar fascia pain. This has a heel spur. This is a 25-year-old foot right here, and it has no heel spur. So if you're taking a look at the 2 different foot models, one person is 25 and the other person is 75, but they're the same person. So look at the osteoarthritis and look at the heel spurs that we show on these 2 different foot models. So what I'm going to do now, I'm going to put a plantar fascia strip on one of my assistants. So here's what I like to use. I like to use a quick drying skin adhesive. So what I do is lightly put it on here and then let it dry over the next couple of minutes. You want it to be tacky, so it takes a second for it to get tacky. So what I usually do is rub my finger around this area and get it a little bit tacky. See, right now it's not even causing any areas to become sticky. You give it a couple of minutes, let it dry, and then you put that plantar fascia strip tape on there. So what she'll do is have it sit there for a couple of minutes. See, it's still not even tacky. Now it's starting to get a little bit tacky. Okay, hang on for about 2 or 3 minutes and I'll come back. So I have this plantar fascia strip, and it's a moleskin strip, and I apply it to the foot. Okay, now she has a small foot. So I have the large version, I have the small version. This is the small version, and this is the strap that goes on the back of the heel, and then I pull it directly up, just like this, and I want to give a little bit of tension. Now I don't want to have so much tension that I pull it off, but I directly put it on top, and then I bring it up top, just like this, and I come down with it. You can bring the camera over to take a look at this. See how I'm doing this right here? Going up, just like that. I'm putting a little bit of tension on it. And then for hers, I don't have to cut it right here. Okay, I can just bring it up top. Now, the tricky part is this. So I go in here, I cut them several places here. Cut them here. I'll cut it here. I think you can see it better on the medial side. Let's see, I think I just bring it over just like that. Okay, and then if you take it right here, you cut it here, and you can cut it right here. So you can tell it's starting to get tacky right here. So then just bring it down, bring it down, bring it down, bring it down. And I usually have my patients wear this for at least 3 or 4 days. The reason why I have them do this is because it actually, if you keep it on for a long period of time, it will decrease some of that arch pain. So again, what's the purpose of this plantar fascia strip? What it does, it actually holds the plantar fascia arch up at a corrected position. Think about it, if a person has a plantar fasciitis and they're putting all that pressure on the foot coming down like this, if you can put that plantar fascia strip on there and it holds the arch up, it should decrease some of that pain. So this patient should get immediate pain relief from this. It's not a miracle cure. I don't claim it to be a miracle cure, but if it can drop the pain by half, that's one of the things you're looking at, and hopefully the plantar fascia will heal on its own. Thanks for watching, guys. Appreciate it.